What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. Welcome back to my channel. If you had to take a COVID test, or a flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, May 2nd, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. I promise to help keep you safe and informed of what's going on with all the viruses circulating out there. Let's face it, there's been a lot of people sick over the last several years. COVID, that never went away. COVID's still a thing, and in fact, we are getting closer and closer to that summer surge of COVID. Yeah, it could be coming soon. Got some clues about that today. I'll show you later. Want to stay informed with what's going on? Just subscribe down below. Help me reach 10,000 subscribers. Hit that thumbs up button. Hit that notification bell. Share this video with anyone you know. Hey, tell a friend, family member, co-worker. Share it all over social media. And of course, leave your comments in our community down below. I do love to go through all the comments, and I try to respond to as many of them as possible. Alrighty, we do have a lot of things to look at today. We have several news stories which do include some bits of data, and then we do have some of our daily data, and we do have some weekly data from the CDC, and something I don't usually do on Fridays, or at least as of recently, is show you a wastewater scan. There's a couple things there, well, at least one or two things there that we'll take a look at if there's time at the end of this video. Alright, starting off today in France, and this is not something that's new. We've had a few of these here in the United States, but France's new nasal vaccine aims to cut COVID transmission. And like I said, this is nothing new. Maybe new to France, I don't know. But there's been several different places trying to get something like this going. I think the UK may have been one. I know here in the United States there have been a couple that have been tested. But yes, a nasal vaccine. We'll have to see. It's a potential thing in the future. We'll have to see if it does anything. Then we move on now to this. Long COVID is keeping kids out of school, doctor warns. And yes, this is something we have suspected. Some of us may have already known about. You know, some who are teachers. I'm sure I got some teachers here that watch my video. If you're a teacher, let me know down below. Are you noticing more absentees in your school? Maybe in your own classroom? Are you noticing it's because of kids sick? Yeah, this is a real big problem. And there's kind of a, how can I put this here? A disconnect. Many of it is because kids are, you know, they're sick. But then there's also the legal side of things where, you know, the authorities are starting to step in. Hey, your child needs to be at school. We need to get you to school. We can have court orders, whatever the case may be. However they do it, truancy officers. I know that's the thing here in Philadelphia. Was before the pandemic. But, you know, they're coming out and saying, hey, your child's got to get to school. But the reason they're actually not going to school is because they have long COVID. You know, they're sick. They're constantly tired. Dealing with all these problems. You know, kids can deal with a lot of the same long COVID problems that parents do. In fact, kids can go on to get it just as severe. I mean, we are learning more and more. Remember the early days of the pandemic? Oh, kids can't get it bad, but we got to be careful. We don't want kids to give it to their grandparents, but don't worry, your kids can't get it bad. Bunk, bunk, bunk. That's a bunch of, I don't want to say a curse word, but I'll give you the initials. It's a bunch of BS. Because guess what? Kids can get COVID bad. We are learning more and more about this each and every day, and it is causing there to be problems with kids being absent from school because they get COVID, and they don't ever fully get better, and they don't feel well enough to go to school, so the parents are like, well, what should we do? It's a real problem. This whole article, you're going to be able to read it. You can read it over on X, and Blue Sky, and Plus. I am probably going to do a thread today on the stories that I share on here over on my site, datareport.info. Of course, you could probably also Google this, and maybe you'll be able to find it. It's from a news source somewhere out on the West Coast, Your Central Valley. I believe this was from California. So, yeah, I mean, it is a real problem. I could go on about that for a while, but we have a lot of other things to get to. All right, we do have, oh, I know I'm going to say this wrong, Enid, am I saying that right? I don't even know. Enid high school students to be tested for tuberculosis after case found. Yeah, this is not good. This is in Oklahoma. High school students in Enid, Oklahoma will be tested for tuberculosis after the Garfield County Health Department identified an active case last week, with patients informed of the potential exposure via email on Wednesday. And it seems like when one virus starts picking up the pace again, others do as well, because we just heard about a TB case in Florida the other day in a high school. So, yeah, things are starting to pick up again. The news, it's definitely getting busier, and measles is no exception to that. As we know, we'll talk about the United States in a moment. Officials warn of possible measles exposure at Ripley's Aquarium in Toronto. Yeah, isn't this lovely? So, you want to have a nice family outing? Oh, let's take the kids to the aquarium today. Oh, darn, I did not have on my checklist, I did not have on the things that I was expecting to see today being someone infected with measles. I thought we were going to see dolphins, whales, fish, and things. Measles? Oh, that's one of the exhibits? Yeah, it could be one of the attractions at these places. And, you got to start thinking about summertime. The amusement parks, they're opening now. Start thinking, you go on the rides, you go to get that funnel cake or maybe cotton candy or something, or a hot dog. Just know measles may be one of the visitors of the park as well. It's that time of year. All right, here in the United States, our health leader said things may be starting to drop, but new data today says otherwise. In Texas today, there have been another 20 cases. I believe the previous update was an increase of 17, so this update, today's, is a little bit higher than the Tuesday update. 683 cases now in Texas, and let's just go through some counties. Gaines County, that's really the jackpot, the hardest hit. 396 cases. El Paso, 38. Dawson, 36. Ector, 11 cases. Lamar, 17 cases. Lubbock, 50 cases. Terry now has 59 cases at this time. And here's something else that's concerning, and it's not just concerning here, it's concerning nationally as well. We're starting to see a few more here and there, either one-dose vaccinated or two-dose vaccinated cases. There are now 13 one-dose vaccinated cases, and 2+ doses is now 17 cases, but 653 of the cases are still unknown and unvaccinated, so that's still the majority, but we're watching this. We're watching that gap open up just a little bit. And now for the national update. Yeah, we're getting closer to that 1,000 mark. 935 cases now. Yeah, a little bit of a bigger, I think this may be a bigger increase this week, but I could be wrong. Taking a look here, maybe I should start charting this. May not be a bad idea. There's a couple things I've been wanting to chart. I think I may start doing that. I found a free chart program today. 935 cases, and look at this. Yeah. Remember before it was 97% unvaccinated or unknown? Now it's 96%. And again, I said this the other day. I think this is just telling me that we're just missing so many cases. That with there being some rare breakthrough cases, I hate to even say that, because remember when they said, breakthrough cases were rare with COVID. Yeah, I hate to even say that, but I think one of the issues could be we're missing cases, and two, I would love to know how many of these fully vaccinated cases had multiple cases of COVID, because we know COVID can do damage to the immune system, and if your immune system's damaged, well, heck, that could damage any immunity that you got maybe from the measles vaccine and whenever you got it. So, yeah, 1 MMR dose, 2%. 2 MMR dose is now a 2% as well. 13% of the cases were hospitalized. That's 121 out of 935. I don't know if next week's going to be when we hit 1,000, but I would think we hit 1,000 probably before Memorial Day weekend at this rate, unless something drastically changes. All right, moving on now. I always like to look ahead and try and figure out what could potentially be the next variant, because right now, I honestly don't know what the summer variant is going to be. We had that LP 8.1 variant, which is dominant here in the United States, but at some point, something is going to take over that variant. And there is now an NB.1.8.1, which I think I mentioned before, talked about it in Singapore. Well, it's increasing pretty big in South Korea, Singapore, Thailand. It's 55% of the cases. Queensland is now 1%. And did we not just mention Thailand yesterday? Someone go back to yesterday's video. Let me know. Did we talk about 3,000 case increase in Thailand? I thought we did. I know we did somewhere. over internationally. I can't remember everything. Remember, long COVID, I get mixed up sometimes. But Queensland, 1% in 3.1 to 4.9, and now it's gone up to 15% of the cases. Yeah, it's going up. Some don't think it's going to be a big deal here. I'm not going to say it will or will not. I'm just saying we need to keep our eyes on it because it is currently increasing in other countries, and the number of countries it's increasing in has also increased. Hey, Queensland, that's part of Australia. And you know, wintertime's coming in Australia. That's concerning. All right, Dennis the COVID info guy. Speaking of Australia, the COVID positivity rate in Australia went up to 3.9%. That's up by 0.2%. But PCR cases, this is Western Australia we're talking about now, just one section of Australia. PCR cases down by 17.3%, 76. Hospitalized, average 26 per day, down by 23.5%. ICU, 7. That'd be the average, so it remains unchanged. And again, all this could change if that variant does start to take over there. Coming back here to the United States, whooping cough cases on the rise in Louisiana. Yeah, and I'm not going to read the whole article too because we do have a lot more things to get through. But the big takeaway here is for 2025, they are now up to 164 cases. And it looks like all of 2024, or excuse me, not all of. In comparison, the state had a total of 153 cases last year. Yeah, so I guess, okay, that is all of last year. But the number of whooping cough cases is going up. And I do want to read this little part. The significant spread of whooping cough is causing increased hospitalizations and deaths. Since September, 40 people in Louisiana have been hospitalized with the illness, and 70% of those hospitalized involve children younger than 1. And this brings me to a very good point. Oftentimes, we're going to skip to COVID for a second. Oftentimes, people say, well, less people are being hospitalized from COVID right now. Okay, stop right there. COVID damages the immune system, and it's helping these other viruses spread more. Whooping cough is one of them. And when these other viruses as a whole spread more, it increases the chances of someone getting hospitalized, and it increases the load on the hospital. I mean, oftentimes you get people that maybe it's not something major. They don't, should I go to the urgent care? Should I go to the ER? And they just decide to go to the ER. Well, you know, all those little minor things add up, and it adds a lot of pressure on the emergency rooms. But, you know, in some cases, rightfully so, they should be at the ER, and they end up getting hospitalized. And you know what? All of this, the increase of various different viruses, increasing in the number of cases year over year, which we're seeing, is leading to more pressure on hospitals. And in some parts of the United States, they're actually losing hospitals, which is making surrounding hospitals busier. It's a problem here in southeast Pennsylvania, just outside of Philadelphia. It is a real issue. We'll look at the Philadelphia hospitals in just a little bit. All right, I have to show you this. I'm giving you a little bit of an early warning. Let's refresh this. We don't want that little notification from X on there, but I'm giving you a little early heads up. Have you noticed over the past week, some people take note to the views of our virus updates. Have you noticed they are starting to go up in views once again? That is an early warning indicator that we may be on the brink of what could be the start of the summer surge. Now, we may be bouncing off the bottom right now, but bouncing off the bottom is usually when we start to see our first sign of increase in views. Take a look here. 7% increase in views over the last 7 days. Watch time is up. Subscribers is up. I blocked out the other tab there, but and you can go back to, I posted the lifetime views as well. And you can see, except for a couple cases where I either took a break or did not post for whatever reason, you can clearly see where the waves were. 2024 is the best example. Take a look here. Back around this time last year, on give or take a few weeks, the summer surge started showing up in my views. Take a look at the summertime. You can clearly see the summer surge. Then you can see where we had that lull in fall, and I actually took a few days off here and there from posting. Kind of regret that now, but I did. Well, there weren't many people watching, but I also needed a break. And then look at the wintertime. It went up. Then it went down at the first peak of flu and COVID and everything. Then flu had that second peak. And flu came into the mix. And with more people being sick, people were just searching on YouTube or whatever it's maybe. What's going on? Well, guess what? Our views went up. Then that peaked and dropped. And take a look at the ends. You can see it. They're it's maybe a little hard to see. Yeah, starting to go up once again. So, yes, this could be the early part of the wave. Good for growing a channel. Not good that's, hey, more people are starting to get sick once again. Speaking of sick, we got to talk about heat-related illnesses. It's that time of year. I'm bringing back the heat-related illness. We may use this page. We may end up using another page. I don't know how that's going to go. But for now, we're using this page. Anything in yellow on this page, minor heat-related illnesses. But you also see orange, which is moderate. So there's a few moderate counties starting to pop up here. North Carolina, Tennessee, and southern Texas. A lot of counties starting to show up. As we get closer towards summer, and then deeper into summer when summer does kick in June, we're going to see this map start to fill in. Eventually, we're going to see those reds, and yeah, even some of these purples will start to show up. All right, taking a look at the viral activity levels in Canada. I need to refresh this, and ruh-roh, we got a problem here. COVID-19 viral activity level in wastewater is moderate. Flu A is high. Flu B is high. And RSV is high. Yeah, that's not a good thing whatsoever. You have to wonder, they just had an election there. Were polling places crowded? Did that contribute to any cases? Not likely the whole entire thing, but maybe a possibility. Alrighty here. We can see here, nothing really new to show you on the website. We do have a couple different things here. I'll have to take a look at that later on. I haven't been paying attention to the website today. But let's see how many birds migrated to the north today, shall we? And we will just quickly go through this. Look at this, birds in flight. And in the millions of birds in flight last night. And if I had to guess, it's probably going to be close to 400 million. Let's see here. Yeah, take a look at that. Wow, it actually goes over 400 million. Almost 500 million. And yeah, that is a lot of birds at any given time. What was that, around 4 a.m.? There were close to 400 million birds. And if you do the whole entire day total, well, the number is even higher than that. So that is really impressive. But it could mean that there is potential spread for bird flu. All right, taking a look at what's going on with air qualities today. And we can see here, if it doesn't load, we're just going to skip. Oh, there it goes. Yeah, some minor bad air qualities in the east and the southeast, and also on the west coast and the Pacific Northwest as well. Taking a look at what's going on with pollen levels. Yeah, from Pennsylvania, Virginia, on westward, back to the west coast. Really, the thick of tree pollen season is right now. Not as bad in the southeast. You have passed your peak. But there's other types of pollen, which you will probably have issues with. Grass pollen, and a whole bunch of weed pollen. Yeah, that type of stuff's going to be starting up pretty soon. Taking a look at Pinellas County, Florida. Hey, not very busy there today. That's a good thing. Philadelphia reported 766 EMS incidents on Thursday. Currently, a live looking at Montgomery County shows a few calls right now, but not terribly busy. Taking a look at Chester County. I hope that little preview that I saw, if we can get this to load. Oh, yeah, there we go. Oh, several respiratory difficulty calls. 1, 2, 3 of them. Even a sick person call. That is not good. And before we continue on, let's pause and take that hydration break, shall we? Water is the drink of choice today. Alrighty, continuing on here, quickly take a look at Pennsylvania hospitals, because you'll be surprised. There's still a lot we need to see. Taking a look here, yikes, overcrowding. Okay, this is outdated, but some overcrowding in southeast Pennsylvania. I wish that would update. And overall, not a whole lot of hospitals dealing with problems today. So that is a good thing. Taking a look at what is going on with New Jersey hospitals, and I think New Jersey's virus update. We're going to get to that either tomorrow or Sunday. We're going to skip over that for now. Inspire Mannington has a specialty issue, also a psychiatric issue at Robert Wood Johnson University Hospital. Yeah, we'll skip over New Jersey for today because I want to get to that new CDC data. Taking a look at what's going on in New York State. 698 people tested positive for COVID in the last 24 hours. You are thankfully dropping at this time. And we're actually starting to see a little bit of a bigger drop in hospitalizations. I hope that can continue for a few more weeks before the wave comes, or maybe even longer. 619 people hospitalized, 44 people in the ICU. Alrighty, time for some new CDC data. First off, emergency department visits are not detecting a surge yet. But that doesn't mean that there isn't a surge. You know what? Could mean maybe the people getting sick right now are less severe. Maybe less people are needing to use the emergency department. This is just one tool that we can look at. There's many others. I showed you one before. One is my channel's data. It's pretty reliable. I mean, it's almost follows the waves to a T. We could still be at that bouncing phase. Here's the latest update on the when it comes to variants, and mind you, this updated last week. LP.8.1 is the leading variant at 69%. Wastewater in the United States. Take a look at this. Yeah, it's not really dropping that much anymore. And take a look at this. Let's show all. Yeah, take a look here. First one, actually, let me show you national one. Well, now we are still in the low category, but look here. Yeah, we're starting to go up a little bit once again. And look where that is. Last year was on the borderline of very low to low. Right now, we're actually a little bit higher. Yeah, that's slightly concerning. It's not a good thing to see wastewater maybe potentially starting to go up for COVID once again. And look at the Midwest. The Midwest is going up slightly. The South is still dropping. The Northeast at this time is still dropping. And the West Coast, yeah, take a look at that. The West has started to go up. It was almost ready to go on the very low. But now it's starting to go up once again. It's still low, but hey, we need to keep an eye on that. Take a look at what's going on with the hospital situation. And it looks like here 73.3% of occupancy is being used. That's just up by 1/10%. And when we take a look at ICU usage, did that go up slightly? I think it did. Yeah, it went up 0.3% to 70.7. So, yeah, that went up slightly. Also, something else that went up slightly. There's a few places here now. This is the influenza-like illness activity map. Most places are fine. This is last week showing you. But watch what happens. New York State dropped, but then take a look here. New Hampshire went back to low. And you also notice Rhode Island, I believe, went to low. But Rhode Island was in moderate last week, so that did drop. Texas also went back to low. Wasn't Texas minimal last week? Yeah, they were, so they went up slightly. And Puerto Rico went up to low as well. And Puerto Rico last week, yeah, they were also listed at minimal. So we'll have to keep our eyes on that. Now, taking a look at the epidemic trends for COVID, you can see here, it is likely growing now in Utah, and it is definitely growing in Hawaii. So when we do Wastewater Sunday, we'll take a look at Hawaii. We're not going to take a look at Hawaii today. Influenza, take a look at this. Everything is fine. Declining. Much of the country is declining when it comes to COVID as well. Just wanted to make you aware of those two states that were showing likely decline or possibly declining. Alrighty, if you saw my little short this morning, I showed you on Wastewater Scan. The Midwest region, when it comes to influenza B, is rising. Well, let's take a look at Ann Arbor, Michigan, and take a look at this. First off, we do see COVID is medium there and rising slightly. RSV is medium. Influenza A is low. We also see influenza B is high, and yes, that is still rising at this time. HMPV still listed high. EVD68 is low. Norovirus is high and slight rise with that. Everything else is fine at this time. So we got to pay attention here. The Midwest, I'll show it to you here. You can see the Midwest region. Yes, also a little bit of a slight rise for COVID, which does match what we just saw with the CDC. But look at influenza B. Yeah, there's quite the rise. There's probably another wastewater site that's rising as well. So something to keep an eye on. Alrighty, folks, that does it for the Friday edition of the Virus Update. If you enjoyed it, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. We'll have updates again all weekend long. I don't know if we'll have any of those YouTube shorts, but we will have full-length updates both tomorrow and Sunday. So, I will see you then. Until I see you again this weekend, stay safe, everyone, and have a fantastic weekend. Thanks for watching.